Hello everyone, my name is Mahmoud Ismail. I'm one of the cardiology fellows at Mayo Clinic, and today I'll be talking about our research evaluating the outcomes of transcatheter versus surgical aortic valve replacement in patients with cardiogenic shock. So just quick background, we know that patients with aortic stenosis and cardiogenic shock are an extremely high-risk population with a dismal prognosis in the absence of a definitive therapy with aortic valve replacement. We know that transcatheter aortic valve replacement, or TAVR, has emerged as a treatment option for patients with severe aortic stenosis who are at high surgical risk. However, how TAVR outcomes compare to surgical aortic valve replacement, or SAVR, in patients with cardiogenic shock remains unknown. So the purpose of the study was to compare the outcomes of TAVR versus SAVR in patients with aortic stenosis and cardiogenic shock. So this was a retrospective cohort study that used the National Inpatient Sample Database in the US between 2016 and 2020 to identify patients who were hospitalized for cardiogenic shock who underwent aortic valve replacement. The goal again was to compare the outcomes of TAVR versus SAVR in cardiogenic shock. Our primary outcome was in-hospital mortality, and our secondary outcomes included procedural complications such as stroke, the need for permanent pacemaker, acute kidney injury, major bleeding, the need for blood transfusions, prosthetic valve dysfunction, and vascular injury. We also evaluated length of stay and total costs. We also evaluated the trends in TAVR and SAVR used in patients with cardiogenic shock over the study period. We were able to identify around 23,550 patients who were hospitalized for cardiogenic shock and aortic stenosis, of whom the vast majority, 77.5%, underwent SAVR and 22.5% underwent TAVR. After adjusting for various demographic and clinical factors listed here at the bottom left, we found that the rates of in-hospital mortality and permanent pacemaker insertion were similar between TAVR and SAVR. We did find that the odds of stroke, acute kidney injury, major bleeding, and blood transfusions were lower in patients who underwent TAVR compared to SAVR. And we did find that the odds of prosthetic valve dysfunction and vascular injury were higher in those who underwent TAVR compared to SAVR. It's important to note that the length of stay was shorter and the total costs were lower in those who underwent TAVR compared to SAVR. And when we looked at the trends, we noticed that over the 5-year study period, there was an increase in the use of TAVR from 2016 to 2020, which was accompanied by a significant decrease in the use of SAVR from 2016 to 2020 in patients admitted with cardiogenic shock and aortic stenosis. So to conclude, for patients with aortic stenosis and cardiogenic shock, TAVR is a feasible treatment option with similar in-hospital mortality compared to SAVR, and further research is necessary to confirm our findings. Thank you very much for your time, and I look forward to your questions.